Hi, everyone. Welcome to our one-to-one video interview with MP Nathaniel Erskine Smith. My name is Jared Cohen. I'm the policy advisor responsible for cannabis policy here at the Canadian Chamber of Commerce. We're joined today by Nathaniel Erskine Smith, the MP for Beaches East York, and who's been an MP since 2015 and has been a strong advocate for the cannabis sector here in Canada. Mr. Erskine Smith, thank you for joining us today.
Yeah, thanks for having me.
So I just kind of want to get things quite underway here. First of all, when do you think the Cannabis Act review will start?
Well, it should have started already, but for the election. And so with the election in place and with a new minister now in place at health, I have engaged and asked questions on this already. And my expectation is that it is a priority. I know it's a priority file because of the legislative timeline, but I would expect this to get underway in the coming months. I don't think we're talking about weeks at the moment. And I would hope it gets underway before the end of the year, and then we can start to see submissions and start to see parliamentary engagement. I know we have a cannabis caucus that wants to get underway and get going, and we're looking for a full rundown from the department as to the 3-year review and what is on the agenda and what the focus is to be and what they see getting the most out of this review. And then we will, as parliamentarians from different parties, there's a member from the NDP and a member from the Conservatives engaged on this as well. And we're going to seek feedback ourselves from industry, from patient advocates, from those who are interested in justice reform and rectifying the injustice of criminalization of cannabis in the past. And so all of that, I hope, will be part of the 3-year review, and we'll push those ideas onto the agenda as well. But yeah, in terms of timeline, I think it's not clear yet, but we're looking at it getting underway, hopefully sooner than later, but in the coming months.
Yeah, no, that's all very important. I mean, given that the federal government only has about 18 months to review the act, that sounds like a pretty tall order. Not to mention what industry wants in terms of the economic side. So, I mean, given that, should Health Canada sort of divvy up the responsibilities? Like, where would you recommend that that an economic mandate lie within the federal government?
It's a good question, because Health Canada has not been the rules that they put in place, certainly from the get-go, have overwhelmingly been focused, and rightly so. Keep in mind, for good reasons, as we pursue legalization for the first time, a public health approach should be first and foremost. But they certainly weren't taking an industry perspective on rules that really didn't have a rational basis. So the best example I can give is a consumer of cannabis. I would say, when I go to the OCS or when I go to a retail store, I can only buy 5 cans of 2.5 milligram 355 milliliter. It makes no sense when I can go buy, a 2.6 of vodka, which is obviously much more potent as far as intoxication goes. And so we are going to have to rationalize the rules in keeping with potency as opposed to weight. That's an obvious one, and I think we will fix that. But clearly, Health Canada was not taking a particular industry view. Otherwise, that wouldn't have been a rule in place in the first instance. And so I think industry's voice is going to be incredibly important for doing away with some of these rules that really don't have a public health basis and don't have really any rational foundation, and getting out of the way. So we do see not only public health concerns be maintained in relation to prohibitions on commercial advertising, but we continue to see, an expansion of a really worthwhile industry, not only here at home, but abroad, and really hoping that the industry here at home can take advantage of what's going to go on abroad.
So let's actually move on to that then a little bit. How, there's a lot of opportunity here. I mean, cannabis is a relatively nascent industry in the last 3 years as a legal industry. So, how do you see perhaps the creation of some sort of domestic supply chain evolving, involving all kind of parts of the industry, from licensed producers to retailers and everyone, basically, to consumers, to everyone in between? How do you think that could be created, first domestically and then abroad?
So as a parliamentarian who is going to take the best advice I receive, not only from advocates in the sector as a matter of fairness, but also industry advocates who want to see greater economic return and opportunity, I'm not going to be so prescriptive in the sense that I don't have this all worked out in terms of how we fix domestic supply chains. But I would say that myself, Don Davies from the NDP, and Scott Reid from the Conservatives, we very much want to hear the perspective of industry for how we can facilitate the expansion of this sector and how we can facilitate the sustained success of this sector. And when we look at the opportunities abroad, there will be opportunities, but there will also be challenges because, there are immense opportunities, of course, as we see President Biden say he will decriminalize, and we see Mexico moving forward with legalization. I've engaged with a senator there on that subject. They actually had a delegation come up from Mexico, met with me and met with others at Health Canada included to see how we were legalizing cannabis and the right approach there. But there will be many opportunities around the world. But obviously, if you look at a place like Mexico, they will have great advantages on the supply side too, right? So there will be great competition that comes with the opportunity at the same time. And we have to, I think, have ministers not only at health, but hopefully a minister at industry and hopefully a minister, frankly, at international trade. And so to answer both this question and your previous question, I think we have to bring perspectives from all of these ministries to ensure that we don't only take a health lens to say, how do we reduce use? How do we have a public health focus? And how do we manage extant public health concerns and ensure that Canadians can also engage in this recreational activity as responsible adults? But we also say, as with alcohol, as with any number of economic opportunities, there's an opportunity we should seize here. And especially as we're one of the world leaders on this to date, but the rest of the world is going to come around, and they are increasingly coming around.
Yeah, no, that's a very good point. I mean, Canada's only the second country to actually legalize cannabis for recreational use, right? So there, as you're saying, tremendous opportunities and challenges exist for us domestically and abroad. And I mean, that's going to be something that we talk about later in this event in the agenda. So I guess then, kind of broadly speaking, then just put on the user crystal ball for a moment. Where do you see the cannabis sector kind of evolving after the 18-month review, or after the review is over?
Well, I hope that we get the list of regulations and the list of rules that are barriers to the success of the industry. I hope in the course of this review, my goal as a member of this cannabis caucus is to ensure that we delineate those rules. We lean into health to say these are rules that don't have a foundation that we should eliminate to make sure we support the sector. I think we have to also ensure that the sector isn't discriminated against because it is, I think there is a hangover at times. If we look at EDC or we look at that, the involvement on the international side and supporting the growth of the sector, I think we have to get over the hangover of criminalization and understand this is a market that there's great opportunity in and we want to succeed. And I think too, I hope we get our heads around the difference between THC, CBD, and those markets are delineated in clearer terms, because there's no reason that CBD product alone needs to be sold in a really tightly controlled environment in the same way as a THC focused product would have to be controlled. So I hope we see some rationalization consistent with the science and consistent with the evidence, frankly. In terms of where the industry goes, I mean, I hope it's not such a different answer in some respects. I hope we do have members from health, members from industry, and members from international trade that at the end of this 3-year review, they're on the same page, and we don't wait for a 3-year review to get things right, but there's a proactive, constructive, ongoing effort to say, let's understand the challenges of the industry and let's address the challenges of the industry, and that work continues in between 3-year cycles.
Yeah, no, that's exactly it. I think there needs to be that kind of holistic kind of approach to regulation and enforcement and legalization. So I guess one thing I wanted to kind of touch on, you mentioned CBD products, the differentiation between THC and CBD. And I think, speaking for myself here, I think that's where the future perhaps of cannabis might end up, is in these kind of CBD products, as more and more users, try and maximize the use of CBD rather than THC. So what do you think Health Canada, or maybe it's probably just Health Canada, what do you think Health Canada can do to spur the kind of innovation of these medical products?
So the work in part is underway. So there is, to my knowledge, an expert panel of sorts that is looking at this issue to see how we can regulate differently CBD only products versus some combination of THC and CBD. And Kevin Page's Institute for Fiscal Studies and Democracy has done an economic analysis to say, here's the economic opportunity in CBD, and it's a significant one. And I think it's one we should realize. And so I think we just have to pursue with greater haste the work of that panel and realize the recommendations ultimately of that panel, which I have no doubt will be, let's treat these products differently. I mean, the public health concern has to be, and I would say more broadly than public health, but the government's concern overall, in my view, should be twofold. I mean, one, we should be concerned about problematic use and limiting the effects and encouraging responsible use. And that means that, yes, more tightly controlled THC products where intoxication is more serious. And the second element, though, in the CBD market and potentially some combination, but especially the CBD market, is around stringency and transparency of and ensuring that claims are science backed, because without a strong regulatory framework in place, without a real set of public rules, we end up seeing products that there are claims, health claims in particular, of all sorts. And so I think that's got to be the focus in the CBD market, as any natural health product. I mean, you need the focus to be on what are the actual science-backed claims, and can these claims be backed by science? And if they can't be, then they can't be made. And I think that's got to be the focus overwhelmingly as it relates to CBD products. But in terms of how we can better facilitate the health marketplace, I mean, there's a whole other conversation we could have about, and it would come down to R&D dollars, I think, from the government, but how we can also facilitate synthetics and how we can facilitate cannabis derived products with drug identification numbers to ensure that patients have stronger access to medicine in this space too. Cannabis alone is great, but the challenge that we face, and we get into a patient advocacy conversation too, but the challenge we face there right now is there are excise taxes applied to a patient product. I mean, a medical product. That makes no sense at all. And the exception is if it's got a drug identification number. So hopefully more products get there. But we also, in the meantime, I think, have to get rid of the excise tax for medical cannabis. So there's a lot of, not only industry perspective, although industry, I would say, has been quite strong on patient advocacy as well. And in some cases, industry has forgiven for the patient the amount of the excise tax.
Yeah, and that's something that we've definitely advocated for, is either the elimination of the excise tax on medical cannabis or the creation of a unified excise tax on cannabis, putting it in the other in the vein of other sin taxes, right?
Exactly.
So I guess the last thing I would ask then, we're talking a lot about the federal government, but then do you think there's any kind of role for the provinces or even other orders of government in the future of cannabis, and how we can create a pan-Canadian approach?
I'm not sure that I've got a ready answer for that. Obviously, other levels of government have a role to play, especially as it relates to, in the Canadian construct, the retail environment. And so ensuring that, the one worry I would have right now when I see many retail stores pop up across the city here in Toronto and the province, I don't know how sustainable that is, frankly. And we saw an overbuild of supply and then a cratering at some point. And I worry that we'll see the same thing on the retail side. So I think, and in any new market, you're going to get that level of excitement, and that will happen to varying degrees. But I do think the province and the federal government, provinces and the federal government, do need to work together, not only to ensure that the retail side and distribution side is integrated well with the supply and production side, but also to ensure that we facilitate craft cannabis in some ways to a greater degree. This idea that right now, if I go to the OCS, I get the same list of products that I'm going to get from any retail. There's no differentiation really between retail environments. And I think we will get to a place at some point where there will be certain retailers that are aligned with certain products, and we have yet to get there. There's a uniformity to the marketplace that I don't think makes any sense in a long-term perspective. So I think we'll see newer products. I don't know about you. I drink cannabis tea, and there aren't so many tea products, frankly, that I can purchase to my liking. And so I think we'll see a continued expansion of that. But I do think federal and provincial governments need to come to the table with that same lens, right? Not only a health-focused lens, which is important and unquestionably the principal lens, but also the lens of how do we ensure that we have a responsibly controlled marketplace to facilitate use for Canadian adults.
No, that's great, and that's a great way, I think, to end this conversation. So, Mr. Erskine Smith, I want to say thank you so much for your time, and thank you so much for the insights. And we look forward to seeing where the review goes. And yes, thank you so much for joining us.
Yeah, thank you.